Few give a thought to the function of pelvic joints. The sacroiliac facet irregulates have baffled all throughout history due to industry professionals either ignoring it or looking to current and past wisdom which has lacked in-depth research and study. Every joint's purpose is to guide movement. The sacroiliac joints are no different. They guide the legs via the acetabulum. They are weight-bearing joints that have the freedom to move in almost every angle to guide the legs along its cleverly designed surface. When you look at the sacroiliac joint, it is a maze of uneven surfaces that look like they've been designed by committee. If we're to look to the past for answers, we must bear in mind that although Dr. Still, the founder of osteopathy, emphasized the interrelationship between structure and function, there has been little progress to understand the sacroiliac joint in the intervening years. Dubious research carried out on lesioned joints concluded that the joints semi-dislocated with every step, in a simplistic fashion. John Bayliss seeks to look beyond this overly simplified thinking by taking into account the important functions at play. Many know John Bayliss as the osteopath who worked out how the rest of the spine articulates and what an osteopathic lesion was on a bony level. This is in stark contrast to the ligament and muscle spasm theory currently being taught at training establishments, a theory that John strongly disagrees with. From extensive research, John worked out how to correct an osteopathic lesion with no click and with the patient in a comfortable position, hardly knowing that they'd been manipulated. Each contour directs their acetabulum to angle the legs. Whilst the leading leg is forward, the other twists and remains weight-bearing. The iliac and sacral facets are cleverly designed joints. It is a pity that it took till 2024 for John to look at the joint from a functional point of view to understand what the irregular surfaces do. Most authors refer to the raised area down the middle of the iliac facets. However, the top half is weight-bearing and the lower half is leg placement. That's because humans have two legs for walking. One goes forward, while one stays backwards. There are two distinct operations. They would not be the same on both sides. Try this for yourself. Stand and take a step forward. The leading leg automatically lifts and goes forward as it turns in for the person to walk straight, whilst the weight-bearing leg rotates to accommodate the swivel action. It was imagined that this action was muscle-driven. It is to an extent, but remember, movement is governed by the facet shape of the bones directing possible motion. John's book, The Pelvic Book, explains what the sacroiliac facet surfaces mean. It contains numerous in-depth diagrams and photos with thorough explanations. It also explains why corrected sacroiliac and iliosacral lesions go out of place to their previous lesion position after weight bearing, and how to correct this.